cold, cough, depending on the age, or with fever or without fever, we have to divide. Infant with cold or cough, with fever, viral infections, bacterial, or even protracted sinusitis or bronchitis, tuberculosis. We have to look for the repeated source also, or underlying inflammation because of the allergy, or chronic disorders like ciliary dyskinesias, cystic fibrosis, immunodeficiency syndromes. In infant without fever, gastroesophageal reflux diseases, structural abnormalities as well as aberrant artery compressions on the airways, vocal cord paralysis, hemangiomas or arachnoid cysts at the vocal cord, nasal or airway foreign bodies, fibrotic band compressions on airways or congenital cysts in the lungs, congenital heart disease is a common condition, or allergy to the aeroallergens or the food allergies, specifically milk and other cross-reactivity to the foods. Then children with fever, infections as viral or bacterial or tuberculosis, or secondary infections in structural abnormalities as mentioned above, or foreign bodies, and those children going to the nurseries or playgroups. Without fever, specifically a family history of atopy or allergy, not only to the parents but even the grandparents also. Allergy leading to the cold with postnasal dribbling because of rhinitis, sinusitis, otitis, as well as lower airway as bronchitis, asthma. Even in children's exercise-induced cough and multi-trigger as environmental pollution, as the children may be carried into the rickshaws or the vans which are at the lower levels because of the vehicular pollution, their exhaust, they trigger the things. Or the child staying in the sugar factory area or industrial area. And indoor pollutants as smoke because of the firewoods or burnt tobacco, like people use the viscera, or floor cleaners as irritants, scents or deodorants used, or the powder used as a cosmetic reason. Then important factor is the allergen exposure, like dust mites into the beds, sofas, curtains, contaminated even the wheat flours or peanuts, chutneys, or other powdered forms of grains, where continuously the hand is used and the human dandruff, they set into that and they get contaminated with the dust mites. Then some other universal allergens like cats and dog dandruffs are all in public places, in the schools, are there in the daycare centers. It has been studied by scientifically. And these dandruffs, they travel around kilometers together from somebody's clothes to another person, and they will be exposed to that. Or the molds on the food particles in the corners of the kitchen or in the freeze, even the scrapings of the freeze have been taken, there are molds have been formed. Or the gaps of the seats into the deep pockets in the cars where the people eat something and the food particles, they are there and the molds happen over there. Then even the molds are with the vegetables and fruits, because it has been documented there are fungus into the vegetables, and these are all mixed up in the market yard and they are carried again into the home. Then air conditioner filters or their tubings or the central ducts of the air conditioners into the specifically malls and all, if the child is carried along with the parents repeatedly. Even in the DMarts, there are all the grain dust and all together, and if the children are carried to such type of places, they get allergens are triggered because of that. Then store mites or floor mites in the carpets, doormats, or artificial POPs or showcases where the dust is not cleaned regularly. Then pollen allergy is increased by 200 times because of the vehicle or exhaust, construction dust and all. When these dust sit on the pollens, their potency has gone up by 200 times. And then they will have a continuous inflammation. And because of this continuous sensitization, and the inflammation is a continuous process, and one fine day the patient will have a trigger because of some of the other things. And some of the pollens, they travel kilometers together. So we cannot filter the air, and because of that, the child will be exposed to that. Then pigeon feathers and droppings, that is a menace in city-like places and even in rural district places also. And these droppings again, they get a fungus after some time, and this will be again potent for the child. Adolescents, along with the allergies and other some of the reasons like GERD and all, the smoking and lifestyle, as air conditioners use in malls as well as into the classes, these have a exposure to that, and they will trigger the cough and cold. Even in children with adenoids or tonsillar hypertrophy, the dust mites and molds at house or the bathrooms of the schools or damp walls are the main allergens causing the nasal and airway symptoms, and imbalance of the Th2 and Th1 cells, which causes the secondary infections. That's why they have the repeated adenoitis or tonsillitis, which may lead to the open mouth breathing and postnasal dribbling. This sinusitis prolonging the cough cold as pressure because of the turbinate hypertrophy obstructing the drainage of the sinuses openings, as well as inflammation, which is a chronic pressure which causes a thickening in the sinuses and narrowing of the openings of the sinuses. And again, the sniffling, most of the patients in India, they do the sniffling inside rather than sneezing out. That forcefully reverses the mucus again into the sinuses, and it obstructs the openings, and it will have a slow drainage into the meatasis, which will cause a repeated cold, the blocker's nose, as well as sneezings, and it will cause a postnasal dribbling, which will prolong the cough in these cases. And again, the secondary infections will be there. And because of the sniffing, again, the patient can have a eustachian tube blockage and otitis media, which can cause a repeated cough.